Stridor, which is an abnormal harsh monomorphic respiratory sound produced by the turbulent air passing through a narrowed airway and indicates a pathology of the larger airway such as obstruction at the level of supraglottic, glottic, subglottic or the trachea. Now how we will manage a case of Stridor? For management, we either have an initial management or a specific management. In case of initial management, the patient should be kept in a comfortable position, especially the infants. They should be held by the mother in their lap. Avoid agitation and postpone cannulation and other painful stimuli. Oxygen therapy in a non-threatening manner to maintain oxygen saturation of more than 94%. Do not insert any tongue depressor and avoid aggressive local oral examinations unless indicated and the patient is stable. Avoid sedation until the airway is secured, and endotracheal intubation or tracheostomy is indicated in severe cases of impending respiratory failure. For specific management, after initial stabilization, we can divide the group into two, either mild group or moderate to severe group. In case of mild, we have oral dexamethasone, it is to be given at a dose of 0.6 mg per kg. And before discharging the patient, we have to explain the warning signs like worsening of stridor, altered sensorium, and poor feeding. But in case of moderate to severe group, we have to firstly admit the patient and then give him or her the adrenaline nebulization, which is undiluted 1:1000, 0.5 ml per kg, which is mixed with normal saline, and we have to give it to a maximum dose of 5 ml. For specific etiologies like bacterial tracheitis, we have IV antibiotics like cloxacillin, clindamycin, and amikacin. For retropharyngeal abscess, we have surgical drainage and antibiotics. For angioneurotic edema, again we'll give adrenaline intramuscular injection of 0.01 ml per kg. For diphtheria, we have diphtheria antitoxin and antibiotics. For post-extubation, there is again IV dexamethasone and adrenaline nebulization. And for post-burns, there is early elective endotracheal intubation.